So these patterns, from my perspective, are the patterns we need to be intervening in, sometimes repetitions. And the importance of it all is that we know, and I won't go through it because I know you've heard about some of that yesterday, but we know a lot about the way in which abuse, exposure to violence, whether that's direct or indirect in infancy, are risk factors for both later abusive behaviour and importantly for re-victimisation. So what children are learning in the context of traumatic relationships, what children are learning when they might witness attacks upon their primary attachment figure, their mother, and so on, are the ways in which relationships are operating, the power dynamics in relationships, the way in which there can be victims and there can be perpetrators, to that very rigid model, which sadly for some children is carried forward mentally and psychologically to the extent that they will actually end up stuck with that relational dynamic. And that's very clearly what we see working with some people who've survived abusive experiences. Some of the mothers I work with are very easily re-victimised. They find it very difficult to make safe judgments about relationships. If they have an opportunity to meet someone new and they're in let's say in a crowded room of 49 good people and one bad person, they're much more likely to take up with the person who's potentially threatening or dangerous. And there's very complex unconscious things going on there. And very sadly, some women are feeling, if I change enough or if I go through this type of relationship one more time, this time it might work out. It might work, it might be okay. Or I think even more concerningly, dynamics where some women are very re-victimised to the extent that they feel powerless to change or worthless and not deserving of better quality of interaction and relationships. And of course that will fundamentally influence their parenting. So very sadly, some of the women I work with do find it difficult to protect their children, might find it difficult to recognise that they actually set up conditions where children might potentially be abused or be at risk. And the tremendously hard challenge it is to work for someone who's actually been involved, as a woman I saw recently with a serial paedophile who abused her own children, and she had desperate wishes that this was going to be a positive relationship for her and was seemingly blind to some of the danger signals. So part of our work is to identify those risk factors early, before those sorts of situations, build up that capacity to make judgments about personal safety, safety in relationships, being self-protective, obviously, as well as protective of children. But that can be quite intense work, and I think, again, that raises the issue of how do we orient our services around providing that as core business. Is prevention of child abuse and neglect and exploitation of survivors of abuse core business? Well, absolutely it should be. Is it seen that way at the moment? No. And I think that again is one of the challenges that maybe we can talk about. So we have those opportunities, but we're underutilising them in a fundamental way. Some antenatal services are oriented in that way. So where I work, we have a so-called high-risk antenatal service where we see women with abuse histories, current relational difficulties, drug and alcohol, mental health problems, that sort of cluster of difficulties, in a service where we're very much trying to provide one-stop shop approach so that someone, if they need a drug and alcohol counsellor, can see that person. If they need psychological support, they'll see mental health. They'll also have have a midwife who they can develop a trusting and caring relationship with throughout their pregnancy to help deal with a lot of the anxieties that they have about that. But that needs thought. Those sorts of systems don't develop spontaneously, and they need to be based on an awareness of what the shared endeavour is. What are we actually trying to do by getting in early? Then we need services that work with children. And again, starting from the very young, the babies that I would work with, where sadly I sometimes see the way in which trauma can be reenacted in the relationship with the child. The child can bring back memories, and the way the parent can or can't or struggles to interact with the child can actually be a reflection of the way in which their own unresolved trauma is literally reenacted and coming back into the way in which they might feed, care, support and be with their baby. So some of that work, as you can see probably by the language I'm using, is very much being with a parent and a child and talking about, you know, the wonderful opportunity that is, but also being very respectful and aware of what the challenges are. Here we are, you know, you find yourself caught up in a child protection system that thinks you're going to be a bad parent. My job is to provide services to support mothers and babies, and you're struggling with what happened to you in your past. And that's the starting point. We then start talking about the way in which trauma can be disruptive, the way in which trauma can disrupt basic processes in how relationships work, the parent's capacity to read those emotional expressions and communications of the baby. So some of the parents I work with will say in a very clear way, particularly some of the adolescent mums who I see, I don't know what this baby's on about. What do you mean the baby's saying something to me? You know, it's not a model that they have. It's also quite a threatening thing. One young woman said to me, I don't want to get too close to my baby. If I do, things could go wrong. Things that happen to me could happen again. These are very powerful dynamics that we have to be able to work with. So in her way, this young woman was being protective of her child. But from the baby's point of view, you know, really very poor, very confusing to have a parent who literally was frightened of being with her own child. So there are many examples of the way that these traumatic experiences reverberate in early relationships. The importance of identifying them early and actually doing something is, again, as you would have heard yesterday, I think, because of the importance of the infant period of development, the way in which our brains are literally being wired up during the first 3 years of life, the way in which our capacity for later healthy relational functioning and understanding of emotional interactions, all the stuff that we need on a day-to-day basis to function, is literally wired up. And these are being developed in children in the context of their caregiving relationships. So I think in terms of the language that we use, to get back to where I started, I think it's very important that we develop, and part of a process for a group like this is to develop thinking around trauma-informed developmental understandings of mental health problems. Early abuse, childhood adversity, attachment disruption, if you're following the literature, is very clearly related to the onset of every type of mental disorder. It's not just talking about something that you might call post-traumatic stress disorder or borderline disorder. Being sexually abused is associated with higher rates of psychotic symptoms and acute psychosis in adolescence and young adulthood. There's an incredibly strong and increasing literature about the way in which early adversity sets up neurovulnerability, so vulnerability to the entire range of mental disorders. If you believe the statistics, it's complex statistics to try and model these things, but somewhere in the order of a third of adult mental health problems can be directly associated with early abuse and trauma. This is hugely significant. That means that we actually know about one of the most clearly identifiable and potentially preventable causes of mental disorder. And yet we're totally ignoring that. So I think this is a key message. This is a message we need to get to funders. It's a message we need to get to the so-called early intervention movement, the adolescent and youth mental health movement, that they too could be doing something about early intervention and prevention by helping us and acknowledging the reality of trauma and looking at these sorts of approaches. Thank you very much.